Okay, try again. Yeah, I'm going out. I've got to be quick. I didn't think I'd be doing this, but it seems quite relevant because I'm going to another dental show tomorrow. So that'll be 3 in 2 weeks. And, I'm retired. What am I doing? Let's try screen share. Right. Let's see. Right. So if I go back, this is it. Okay, so I made this. This was my first logo, an attempt at a logo, and obviously it's improved on since then. But the way that I started doing this is, I like playing around with art. I'm not an artist, but I thought, this painting wasn't very good, so I thought I could liven it up a bit, and so I took, a photo of it, and I showed it to a friend, and when I pressed the button, it showed how I'd done it. Well, that's interesting, isn't it? Maybe you could use that. So what would you do? So yeah, now I'm no genius, but there are a few of you out there. Maybe you can help us. So the reason I did this, I went to this show and it was last week, on Friday last week. So I'm going to one tomorrow. Actually, it wasn't Friday, it was Tuesday, whatever day it was. There were no dentists there. I think there was one of the dentists who'd been to the show. And there's nothing about dentistry in there at all. There's no funding for dentistry. So I know this because I went on a health innovation course. So that was over 5 days and it was brilliant. It was done by Set Squared, all about innovation. So I've done a few of these courses since I've retired. It's been really useful, but there's no funding. I can't get funding. And at this place, as an example, I went to one stall because it looked like they were using an app. And I thought, oh, I wonder how they use the app. Maybe we can use it for dentistry. Anyway, so they had some chairs there. And I said, do we need to sit in the chair? And they said, well, yes, you sort of need to sit in the chair because it's about exercise. So I've made a video on Hett, because that will reduce your blood pressure rather than take tablets. And let's not go down the route of, food, UPFs. Anyway, so I said, oh, that's good. I won't sit in the chair, but can you explain about it? So what they said, it was for people to help people lose weight by getting more active. So the people would get an Apple Watch. And if they did, and I must have heard this wrong, but they said if they did 10 minutes exercise 3 times a week, then they would get a reward, and it was food vouchers. So they got an Apple Watch for this. If they didn't do the 3 times, 10 minutes exercise, they didn't get rid of it. I said, well, how did you get funding for this? And they said, well, for each patient that they gave the watch to, and the rewards or whatever, it must have been fruit. Christ, it can't have been, go out and buy some spaghetti ball that you heat up. Anyway, it was £800, whereas someone had worked out that it cost £2,000 for someone who stayed idle in a chair. Anyway, they got an Apple Watch. So the interesting thing about the Apple Watch, of course, is you can see mine. It's on my left hand. When I wash my hands, it told me 20 seconds, and something happened a little while ago. So if we had it on our right hand, maybe it'd show when you were cleaning your teeth. If you cleaned your teeth for 2 minutes twice a day, your dental insurance might go down. Anyway, this was grim. The final talk, I heard one guy stand up and say he worked for some health authority. They'd had funding and bought the equipment 4 years ago, but they still weren't able to implement it. And this is a common story. The amount of wastage that goes on within the NHS is just phenomenal. The amount of failed NHS systems is phenomenal. It's billions of pounds. I think there've been 2 or 3. Probably be trying to do another one. And I did speak to the head of digital health, Helen, someone, and I said, I've got the website, dentalhealthservice.co.uk. I started to talk about it. I've got an app. And I said, oh, no, we can't do that. And we were too busy. We've got too many things going on because they've got 16,000 different people or different companies that they have to deal with to get on one platform. An app's on one platform via a cloud. Oh, and people are worried about it being secure. Well, if you do it through WhatsApp, isn't that secure? Whoops. So then the other talk I went to was on sustainability. And like the first slide was about, said about prevention. We need to help with prevention, that could help. I can't even see what it says in the second one. Oh, self-care, right? Lean service and low carbon. So I said, well, I think my app does all those things. And you can see what I've written there if you just pause it. And I have been in touch with the company Telidentics about 2 years ago, looked them up in the States. And he said, oh, yeah, it's a really good idea. I said, well, is there anyone doing teledentistry? You know, because that's something that happened during COVID. Oh, no, I don't think there is. There's no funding for that. In the same way, there's no funding for seeing the outcomes of people who hadn't, you know, did the AAA. There is no money for dentistry. It's nuts, you know. And the outcome was, if you want some research, I need to do it. Yeah. Well, you know, I'm busy. I've got golf. So this is what I ended up with in the end. So these slides are taken from something else, but those two I stuck in because I thought, Christ, it was bad. You know, there's no hope. And so, yeah, for my, yeah, the bottom right, that's what I did. So the app is actually based around this. The two things that I haven't got for an app, for it to be successful, is one is promotion. Well, I'm hoping you're going to do that. I'm going to change the name of the app. You know, I don't give a monkeys. We've got to start helping people. And the other one was, so it needs to be endorsed. So, you know, trying to get an endorsement, no one's going to listen to me, but they may listen to a society. Now, I don't care which society it is. If it's the Dental Hygienist Society, if it's the BDA, well, you know, the College of General Dentists, you know, who cares? The joke was that when I showed it to, I think 7 of the 13 AHDNs, yeah, the academic health science networks, everybody liked it. One, they said I was charging too little, and two, they said they wouldn't use it until it started to make a profit. This is the health service. It's gone nuts. It's, you know, anyway, I've done lots of these courses. Future Learn, do that. It's brilliant. And these are some other things that I've looked at. So nearly all my references are on dentistry because I spent like 30 years doing it. These are other things that obviously I just stuck up on the slides. So these are the things that I've looked at. So skip through them. But this is a good one. Now, this is really interesting. And I make no apology now for my slides being slightly repetitive, because if you look him up, Clayton Christensen, nearly all his slides are repetitive. However, he's sending a message, and obviously I think it was from Harvard Business School. It's either that or Stanford, you know, but what's it, HBR, lots of free stuff to watch him, look him up on YouTube. And he talks about health and he uses a wheel. Oh, I've done research. I don't know what this one was on. So I asked my patients, what's this one on? Yeah, bottom right, if you look at the oral cancer screening results, it says that I said to my patients, would you prefer me to check you once a year, or would you prefer you to check yourself monthly? So the results there, rather once a year. No wonder we got bloody waiting, sorry, no wonder we got waiting lists. Anyway, so that's the course that I did. Fantastic. It's the there are two things that I've had help with. So I applied for this and I got on. I've applied for funding. I applied for funding for cancer screening. Well, it's not really cancer screening, it's pre-screening. So, oops, I got into trouble with my app through Orca. Orca, look at them now. If ever anyone's getting money from the NHS, they are. And then anyway, right. So this was brilliant. The people on it were fantastic. First thing, at the first coffee, the chap I was telling about community dentistry, he'd never heard of it. And, you know, it was clear there's no money for dentistry. We know that. There is money, though, available for cancer screening. I said, oh, my app does that. I says, you know, it gets people just to check themselves, shows them how to check themselves. If you haven't downloaded my app, look it up. And the other one, he says, and there's one, we've got a problem with obesity. So obesity, well, that's diet, isn't it, really? If only the government made an app for that. You know, it could say how much sugar they have, the frequency they have it in. Oh, there's no connection there, surely. So, you know, the idea we should piggyback on other bits of funding. Anyway, the chap that did it, Peter Rhodes, fantastic chap. And it was a great course. Lots of really good people on the course. I wish I had some funding. So this is Clayton Christensen. So this is how I was trying to explain how we can do cancer screening. So again, if you just pause it, you can see it, or look him up online. He's like 6'6", I think, and he's well worth a listen to. So the idea is that if you see people on the outskirts, and we are in primary care, and I'm saying that the app is where it says that it's outside the things, bearing in mind how it's a while since I've seen this, but I did do it. And as you get nearer to the centre, to secondary care, and that's what it's called, tertiary care, but certainly when it comes to any form of care, the further down you go, once you're in the hospital environment, it costs a stack of money, right? So everybody knows that. This is what he goes on about. So now, yeah. So again, so I think this is just the same thing, really. But I'm hoping I've got another one. Right. Okay. So we're the public on the outside, and the oral surgery, and this is for cancer. Okay, and it could be for anything really, anything tricky. It seems now taking out sixes is tricky, so you have to get referred to the hospital because we're nervous about an apical third. I don't know. Anyway, so the nearer the centre, you got the dentists, hygienists cost a bit less, therapists, that's probably in the wrong order, and then you got the public, and then doctors, I think this is referring them for cancer, so that's where they would sit. But the idea was the phone, and so you can set a reminder on the phone to check yourself once a month, and when you're there, have a good poke round, and so that's the pathway that we take, and it's kind of a longer pathway, and there are companies out there already where we have this, where you can go for endoscopy. So, if you look at that company, they're dotted around. So there's no reason why these people could not screen for skin cancer. And I think that's about to start. I have spoken to the company not the company that developed the camera that sits on top of your iPhone. So it augments the camera. They're testing that at the moment. In fact, I've been tested on my back. Hope it works, because they said it was okay. But that was the idea. But they said I couldn't use their system for encrypted sending messages. Yeah, so I'm trying to work out the order. So if you've got teeth for life, yeah, that's what the idea would be. You would fast track. That's right. Getting in to see your dentist or your doctor, certainly your doctor, takes some time. So why not have an online triage? So you take a photo. So this is in the phone. Online triage, and that's where they said, well, we may miss one, in which case we'll get sued. And you're thinking, what about all the people who would just be reassured? So then you get sent along to a diagnostic unit, like I was. This was done before I was tested. I think I did this a couple of years ago, and then you get fast tracked in following that. So you have certain units, and it could well be now in a health place, wherever. But you can see, one is slow and expensive, and two is cheap and quick. And if it's on the phone, I know people say, well, you can't do that and object to it, but we've got to start thinking slightly differently. So this was Clayton Christensen's pathway. Oh, and so I made this a while ago. So if you look on, I'm not sure if these are still on my app, because I sort of worked out another way of doing it. But certainly this is what I'm looking at the moment, is how we can use the phone camera to take better pictures in the mouth, and just to demonstrate that. I mean, we really should. This is just simple stuff, really. It's using the technology that we have already to enable us to improve our health. And yeah, I think there are lots of things that are encrypted messages now. That was the problem when I went to Hett, is every time he said something, there'd be some kind of hurdle in place. So someone's got a job somewhere that says, well, you've got to be about the encrypted messages, and someone's got a job somewhere saying, well, have you got the adequate consent? Is the consent form? Let's have a look at that. Someone will say, well, we had this discussion about whether we should bag up mirrors and probes because of the waste and sustainability. Well, of course, we managed perfectly well for years not doing it. And we've had the metal trays that we all invested in, and we told they weren't good enough. Closed metal trays. We got to do things slightly different. So anyway, I think that's my rant done. I'm not sure where these slides go, so I'll carry on because I'm not going to the circus for 10 minutes. Let's hope it's good. So this is, yeah, these are different apps. The food scanner, I think that's improved. I've just started using that again. And I think we ought to have that on, showing if a food has got, you know, how it is with regards to addiction. Never mind additives. Let's talk about addictives. The dental apps, yeah, some of them have kind of gone by, but these are all off mine. Yeah, there's lots of kiddies apps. So we always tell people to use children's apps because they have little sort of rewards on them, and they vary slightly. And they're really good with the 2 minutes and what have you. Brush DJ is the only one that's been endorsed by Orca, I think. It's the only one on the NHS approved apps website. Oh yeah, the skin cancer one. So the skin cancer, the central medical one is, you know, I downloaded that about 10 years ago, and it's American. Now, if they could do it 10 years ago, you had to pay. It's American. However, why can it be in America and they charge something like $30 to use it, and it can't be free in the UK? Been there 10 years. Oh, and oh yeah, my tool's there at the bottom right. BWE tool. I think they've stopped that now. The BWE tool, in a way, was how I'm trying to think, the makers of Sensodyne started promoting regenerate, which is a really good term. You know, that's a good marketing. Regenerate. It sounds like the tool's going to grow. I think I'm a bit quiet now. I'm not even sure if that app is still available. Obviously, on my app. Oh yeah, so it looks like I put a few arrows there. And this was the kind of the pathway for cancer screening. So I'd forgotten that I'd done this. And the bit at the bottom, that looks a bit too professional to have been me. But that's how, you know, pathways should work. And yeah, all right, this is the guy talking about what
the joy of working with skin analytics is you've been very reactive with suggestions that we've made.
Integral to introducing AI diagnostics were the clinical photographers who helped shape the design of the smartphone.
So you can look that up. Oh yeah, and there's where all these places are in health, which are a private company, but that's where you go if you need to have a endoscopy. Oh, and it looks like I put bits about my app. So yeah, there you are. How you check for oral cancer. This is the one video on my app that isn't made by me, but they gave me permission to use it. And yeah, I've got in the way there, but she's got a pretty smile. Her teeth are intact, and like the one that I made of myself. I should have had a shave. So anyway, moved on. And then, so you set a reminder. So I'm not sure if there's another slide comes up. No, but oops. So there we can see oral cancer. Yeah, you just you know, you slide it over once a month. And on it, there was some there for disclosing. So for children, you'd say disclose, you know, once a fortnight or once a month, and check on children just to get them into the right habits. That's the whole idea using the phone. And this is one just showing you, I think mouth cancer is the 6th most common cancer. Every talk you go on gives slightly different views. So trying to make in the app, there's a scoring system. And when I said to the NHS, I've got a scoring system, it sort of gives an indication. So it's an assessment tool. It's not diagnostic for sure. They said, well, you can't use that. You know, where's your research? And I said, well, I haven't done any research, but I've gone on lots of courses on people who've done the research. Ooh, that's not very good. They say you haven't done your research. I think it's 2 million papers are published every year, and I haven't read them all. And if you go on Cochrane reviews, you think there's one recently about the electric toothbrush saying that they think it's slightly better, potentially, than manual brushing for teenagers and orthodontics. More research is required. I mean, it's just nuts. I mean, nearly all of them say more research is required. If all these people are doing them, what they should do is to go to Cochrane first and say, is this viable? And quite frankly, they're only doing it so they can get a leg up onto the next job. That's not always ideal. What else have I got? Okay, so the habit loop. Claude Hopkins did more for dentistry than any dentist. Look him up. He's on Wikipedia. Claude Hopkins. So when it talks about the two best marketing campaigns on a behavioral science thing I've just listened to, of the top 5, one was Claude Hopkins, and the other guy was the person that invented Listerine, and he marketed on bad breath. It's arguable what Listerine actually does of value, apart from, the same as the toothpaste. It makes your mouth feel fresher, that kind of thing. I know it's being plugged a lot, but really, I tell you what does work is hypochlorite. I remember asking the professor of perio in Bristol years ago, and I was asking about how much you could gargle of Sterilux. And so when it comes to do your endodontics, the amount of hypochlorite you put into a root canal, it's tiny, right? If you put rubber dam on and you're squirting everywhere, then of course you need a rubber dam. But if you just put something down the root canal, how much is that? Anyway, yeah, so I've made a video on habits. I don't think that shows, does it? Oh yeah, so it shows. So anyway, so I've made lots of these videos, and I will remarket them when I get someone who can promote this kind of stuff. So I'm not sure. Let's move on because the circus is coming. Oh yeah, so and that's it. So for habit formation, you need a reward, and children, we always give them badges. And this is a thing on how to get rewards. Just think of one. The one that I'm trying to think of is how you could do for an app. In Australia, you get tokens, I think, for health. If you keep yourself, there's only so many tokens you can use up, and that's a bit of a minefield. But we need to think of something slightly different. So yeah, I used to see, when I first made my app, I used to send people out with a business card. And yeah, we should be telling people about the BPE, but I give them a card with their BPE on. The app explains the BPE, the numbers at the bottom with the hotkeys. Really, there's only a few things you need to know about cleaning your teeth. It's not rocket science. But there's one there on pocket cleaning. And yeah, I made the app I sent a patient a video on pocket cleaning when I thought she's about to lose this tooth, which was supporting a chrome. I thought there's no opening hell on this. Anyway, she came back and it was solid, and my chrome, it was working really well. I thought, that's interesting. So I started sending patients YouTube videos, and then I put them all on a website. And then I thought, I'll make an app, that'll work, that'll help, promote it. And then halfway through doing that, the guy said, well, you can't use those videos. I don't make any money from the app. And I had to make my own video. So the video, if you go into YouTube, Teeth for Life, look at oldest videos. So you think as you go on, you can look at the oldest and the newest. And so I've left everything on there. So all my mistakes are on there. The animations that I make, I think were quite good. And this isn't my first business card, because you can see it's got a QR code on. No one ever knew what they were until COVID, and you needed to download it to get in the pub. So this is how it works. Yeah, so clearly there isn't a BP of 5, but if you had 6 boxes in there, it worked a bit better. So you have to make an adjustment for that. And there are lots of these videos. So let's see what the next one. I tried to make this one because it's remotely engaging. So this is quite, trying to be funny. It's tricky with dentistry. And yeah, the interesting story about this is, have I got time? The interesting story about this is, yeah, the little blue tablet. As you probably know, they were trying to do something about reduced blood pressure. And a few different companies had tried. And then I think it's Pfizer, is it, who now market Viagra? I'm not quite sure which one it is. So they had the same kind of response, and all the clinicians are sitting in the room saying, "Christ, it's not working. It's not reducing the blood pressure." And yeah, someone in the market. So then, and there's this side issue where everyone's, getting this rather excited. And a marketing guy said, "Oh, well, that's interesting. Maybe we can market that instead." And that's how it happened. And the other interesting part was normally when they did these clinical trials, at the end, they'd ask for the tablets back. And so I'm only repeating what I've heard in my podcast. No one give their tablets back. They all hang on to them, the little blue pills. So we should be looking at things differently. Right. So I can't remember why I put that on. Oh yeah, I thought if you took out all your teeth, you wouldn't have gum disease. So I think it was Ian Chappell who's brilliant. Always like listening to him talk. He's very engaging, knows stuff, unlike me. He because you think, oh, if you had all your teeth out, you wouldn't have periodontal disease, then you wouldn't suffer from systemic disease. Fantastic. Maybe not. Yeah, I think you're 3 times more likely to die early if you've lost all your teeth. And this was just an idea on how I can make the app different. And that's putting onto the front page the videos, like 2 on particular on prevention and 2 on potential treatment that people may need. To make this innovation work, it has to be financially viable or induce people to use it. And so having you on the front and it says subscribe to promote prevention and health, I'll change that now and say supports dental health service. So that's the idea. Yeah, on that, and then this is following what the NHS wanted. They want it to be available in multiple languages. Well, that's clearly available now with AI, and so that's why I'm rebuilding it, to build it in. Teledentistry, they want me to fund it. I mean, Christ, I haven't got any money, but it isn't tricky. If anyone wants to learn how to do it, let's do a webinar. Yeah, what's the other one? Booking system to, yeah, that's teledentistry, right? So if you're a hygienist listening to this, using the app, there'd be a portal for you to give oral hygiene instruction to patients that may be on the dentist plan, freeing up the surgery, so that the surgery, quite frankly, generates more money. It's green. You can work from home. Patients are at home. Brilliant for kids, especially if they haven't seen a dentist. They like looking at their phones. They don't listen to the parents. That's got to be viable. I can't find 2 hygienists I've found so far who do this kind of thing. Yeah, the current app, it doesn't keep a history of your BPE. It should. I asked for that. Didn't. It's difficult with these things. And notification. Yeah, so notifications. There's a way of using it to be GDPR compliant. Which when I started was a really big thing. It seems to have gone a little bit quiet, but certainly I want the user to control the notifications. I'd make an app specific for different practices, and then that would probably work better for them in that they could, control the notifications better. And we could just put notifications on our general health. I don't know, smoking's bad for you. Who knew that? No, but there's got to be other things that for general health that we can do, which is what we're trying to say about the videos in the app. They don't all have to about teeth. Yeah, and so that's about having one white label template. That's for practices as opposed to individuals. Oh yeah, well, it looks like I thought about that when I made this. Anyway, but I didn't have the domain name, which I have now. And this is just saying that this is how much money is spent on phones. So instead of with the health service wasting billions on a central server, we can use a cloud using the technologies still already, and everybody has a phone, right? So I reckoned it was worth about 15 billion, £500 a phone, say 40%. Anyway, do the maths. I think it's probably written down there if you pause it. Oh, it looks like I did it. Yeah. Do the maths. And so we need to be using technology different and encouraging people to use it. And people will use it if you give it to them, because we are a trustworthy resource. Yeah, and so I need to get some money for this. And, you know, if it did make a lot of money, don't worry, I'd get a decent barrister and start trying to stop us getting sued for daft stuff. People need to know that good treatment sometimes had bad outcomes. And these specialist advisors, you know, some of them, it's their career, what is it, career specialist, never done any work. Yeah. And so what I've got is a framework already. Have a look and see if you can help us. Send in your advice and suggestions, because we're building it already and hope to have it ready in December 2023. It's now October the 5th. Yeah, can you help? Oh, they're the two bits out of the e-health that I said I needed. It was expertise and third-party endorsement. They're the things that I haven't got. Oh, there we are. Magnified it. That's what I need, right? I'm just a poor retired dentist. But yeah, I'm sure someone can help. And yeah, the NHS can't do everything. People need to know that. When it was brought in, as you know, people were suffering from real deprivation and starving and had rickets. Now a third of the beds are occupied by a different problem. And yeah, this should be in the doctors. I've made, you know, QR codes. I asked Boots to use it. I asked Sainsbury's to use it. And yeah, the idea is that members of the public can share it using their contacts. I think people thought by sharing it, they were sharing their details. Well, it isn't. Just, you know, this could work. Oh yeah, I think this might be the last slide. Oh yeah, and this is asking the College of Dental. I've asked everybody to help me. No one will help me. Everyone's worried. All right, yeah, that's me with the check shirt. Happy days. Oh yeah, that's right. So I'm definitely going to go. My wife's going to call me now. Look this up somewhere else. I made the website for the LDC, and the previous, I just copied the others. And every LDC I contacted said, "Oh, you better not copy ours. You better not copy." It's all damn stuff, right? This is how we can create a dental health service. So certainly pause this and see how it will work. On a different website, I showed how it would work. If you go on the teethforlife.org.uk website, there's a section for FDs, and I think it's on there showing how they can help. And we use Agile, and I made this as well during COVID. Or dental, no, yeah. So I haven't got dentalhealthservice.org. I've got dentalhealthservice.co.uk. Right. Ooh. Okay. Right, that's my watch. I've got to go. Go in the circus. Oh, I hope you've enjoyed this. Were there any more slides? Oh, yeah. This is a good one. So I made this on Toonly. Everything you see, I've made. You can recognize my voice. And I've been told that my voice is boring, but here's when I'm talking about toothbrushing. Anyway, this was the idea. This was about COVID, I think. And he was saying how it's difficult to work at the moment. Right. Just look up his quotes. Right. If you're having a dull day, look at this guy's quotes. Brilliant. We need to look at marketing. So there's him, Clayton Christensen. Oh, and me. That's it. Oh, hope they've got candy floss at the circus.